Have a great day, everyone. My name is Jebby Reyes, Marketing Specialist and Event Director of Asia Pacific Awards Council and Jebby Reyes Talent and Events Management. Since nasa entertainment industry tayo, so gusto kong mas ma-boost yung confidence ko na, alam mo yun, humarap sa maraming tao, lalo na pag nakikipag-usap tayo sa kanila. So, pinaka-major concern ko talaga is nose lift. So, more on enhancement na lang naman para sa procedure na gagawin sa akin. Ayan, Dr.Contessa Alapag is our client under Asia Pacific Awards Council. And then way back 2015 and 17, naging awardees namin siya. That's why, sobrang dedicated at saka trusted na talaga sa mga gawa niya ever since pa. So yun, talagang nung nag-decide ako na magpagawa ng nose lift, yan, si Doc Contessa lang talaga yung #1 choice ko. Please don't forget to like, share, and subscribe Contessa Salvador on her YouTube channel.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, let's talk about the aesthetic ideals of the nose. And we have with us Sir Jebby. Welcome po.
Yes, Doc. Thank you so much.
Right. So looking at Jebby right now, if you look at the center of our face, the nose region, okay, Asian, Filipino nose po talaga, we have this lowest portion of our nose, the radix, na talagang it's not elevated. So for the Asian anatomy of nose, talaga pong yung radix natin is, it really lacks that elevation or there's an inadequate height, right, Jebby? Pare-pareho tayo mga Pinoy, Asian nose, so somehow there's an inadequate height, inadequate length, right? So somehow naman you wanted to improve these features of our nose. Okay, since we are talking about aesthetic ideals, in the nose region, we have certain proportions and ratios. We have to follow those mathematical formula para po ma-achieve yung ideal nose or a beautiful nose. Okay, so proportions and ratios, we've discussed before about the rule of thirds and rule of fifths. Yung thirds, yung horizontal thirds. So the middle horizontal third, ideally it's within that, and then the vertical fifth, it's within that center vertical fifth or in the intercanthal line. Intercanthal line, the width nung from this side na ng ating eye to the opposite side, dapat po yung width ng nose nakapasok doon. Now there are also angles. We've mentioned about nasofrontal angle, which we find here, dorsum of the nose sa itaas. So if we draw a line, so from the nasyon or the lowest part ng ating nose, you can make a straight line, and then from this lowest part, you can also make this tangent line or like a diagonal line. So that's the nasofrontal angle. Now ideally for men, the angle should be like around 135 degrees. For women, it can be 130 degrees. So for Jebby, we have to somehow improve this nasofrontal angle here. So we can elevate this part here to make it near that 130 to 135 degrees. Okay, the next angle that we wanted to also improve, yung tinatawag na nasolabial. Nasolabial is from this columella going downwards to the upper lip. So ideally for men, it should be 90 to 95 degrees. So for Jebby, we have to make the nose follow those angles and proportions. Okay, excited tayo, Jebby, today.
Yeah, sobrang excited daw.
Right. Because actually, Asian nose naman talaga, attractive na. We just wanted, for mga Caucasians nga, when you go in the States, they are telling me na Filipino nose, it's beautiful already. But somehow we wanted to also make it follow those ratios, those proportions, those ideal nasofrontal and nasolabial angle. Ipasok natin doon sa mathematical formula. From attractive to more attractive, right? So, right now, we'll be doing a non-surgical procedure again. How do we improve or correct the nasofrontal angle? And how do we also do this tip projection or also the so-called rotation of the tip? Okay, ating abangan ang actual procedure sa pagbabalik ng CSA Medical Aesthetics. And we're back mga ka-CSA. So we'll now show you the actual procedure on the correction of the nasofrontal angle as well as the nasolabial angle. So the procedure starts with the cleansing of the skin and then also applying the topical numbing cream and also the injection of this lidocaine into the infratip region. So just a 0.1 ml of your lidocaine, inject it into your entry point. And then make your puncture into that entry point. And then I will be starting with my hyaluronic Restylane lift filler. So this is an ideal filler, a high G prime filler for the nose augmentation. Okay, so I'm using a cannula. Actually, you can also use needle for correcting the nasofrontal angle. Some doctors are using angles, directly injecting it into the dorsum of the nose on top of the bone. In my practice, I also use the cannula just to have a single entry. Okay, so my cannula here gliding towards the radix part of the nose. So taking note, you have to stay into the lowest portion or deepest layer of the soft tissue layers of our nose. So grasp the nose and then look for that space, lowermost space, inhale, exhale. Okay, there you go, glide your cannula. Glide towards the radix. So I'm now in the radix. Okay, I'm using again Restylane Lift High G Prime Filler. And then we're pushing into the radix. Taking note that the layer should be on top of the bone, on the upper third of the nose. And then as we pull it, retract it, you are pushing the filler up to the lower third of the nose on top of the cartilage. Okay, then I also fill in the columella to improve the angle here. So using the same entry point towards the anterior nasal spine. Sponge. Okay. This kind of filler also has a lidocaine, so later on it will help in numbing the nose tissue. We just push about a little bit of filler, like 0.1, 0.2 into this region here. Okay. You can still add a little bit more. And there you go. Now we can proceed with our PDO threads. So some people are asking how many threads should you insert. It's a case-to-case basis depending on the height of the dorsum of the nose. Okay. So there is this resistance. Sometimes when you reach the hump area or the rinion part, you will normally feel that resistance there. So you just have to glide the thread. Okay. Actually, this is a PDO thread with an 80mm length of the thread. So the length of the thread could vary. For cases that you have a longer nose, you can use 90mm length of the PDO thread. So we're doing the dorsum bridge. It's ideal to follow that dorsal nasal line and make sure you are midline and on the deepest layer of the 5 anatomical layers of our nose. So you can put as much, taking note of the ideal nasofrontal angle. So this is a polydioxanone type of thread. You can also combine it with your polycaprolactone. So we have several kinds of our threads, PDO, PLLA, PCL. They differ in their duration of effectivity or the longevity of the threads. So I can use a polycaprolactone for the tip projection here. Some are asking how many of these threads should you insert into that columella. Again, it varies depending on your patient's anatomy and desired height. So that will be our last strand. Okay? So we are done with our non-surgical nose lifting procedure. We'll show the result when CSA Medical Aesthetics return. And we're back. We're now going to show the result to Jebby. So here's our mirror. Direct Jebby. Yan. Kamusta po?
Ganda.
Naturally enhanced and within the right ratios and proportions and the right nasofrontal angle. Again, yung kaninang sinasabi ko, yung nasofrontal angle. So, dapat 130 to 135 degrees. And then, the nasolabial angle na pwedeng 90 to 95 or even up to 100 degrees. So, those are the ones that we have targeted today, correcting the deficiencies of those angles. So, within the ratios and proportions. It's not a vanity, but it is something to enhance and boost your confidence. Any message po, direct sa ating mga taga-subaybay?
Again, first of all, I would like to say thank you, Dr.Contessa, for making this possible. You know, sobrang nakakatuwa yung sa result kasi alam mo yun na na parang 100% satisfied ka sa gawa at saka look natural talaga siya. So yun.
Yes.
Thank you
Saka
so
yung
much.
safety.
Yes, yung safety
Kasi,
number one talaga.
Yeah, a lot of people, of course, if they will go through these kinds of procedures, of course, syempre takot yung iba, baka mamaya mabulok or may komplikasyon or magkaroon ng problem. So, nandun po yung safety and also we follow yung mga right technique, right anatomical layer, and what materials we're using, plus yung mga injection points natin within the right guideline or protocol also. Okay, salamat po.
Thank you so much.
Yeah.
No.
So, na-enhance, okay. I like the elevation ng radix part niya, na-define. And at the same time, yung mga eyes niya, also, nag-balance, naging harmonious looking.
Yeah.
Right? So, yung profile ng face, lalo na kung magsa-side view ka, talagang makikita mo yung angle na yon, yung improvement na yon. So, yung
natural siya tingnan.
correct. So, yung lateral view or profile view, gumanda yung angle na yon. Then, yung mga mata ni Jebby, lalong naging alluring eyes. Right? So, thank you so much. And it's another very natural result. And, of course, we could say na Jebby here, sa kanyang activities every day, lalo pa siyang magiging confident. Okay. So, kung meron po silang katanungan, you may email us at csaskinclinic@yahoo.com. Our address is Infinity Shop.